evening. I can't tell you how excited I am to be here tonight and to see all of you here just as excited as I am for this healthcare reform. At this time in our nation's history, we really stand on the edge of making history. Can you hear me now? All right. I just was saying how excited I am at this time in our history that we are truly making history. And if we can accomplish healthcare reform right now, we will change the lives of ourselves and our children for years and years to come. I'd like to just give you a little background about what I do on a day-to-day basis. Again, my name is Britt DeClerc. I'm one of the chief residents over at LA County Hospital, the big white tower down the street. You can kind of see it over those hills. And I'm also the president of the Committee of Interns and Residents, which is our resident union. We represent 1,300 doctors in the Southern California area, as well as nationwide, and we are all for healthcare reform. Over at the county hospital, we are the public option. A public option currently exists. We do not turn anyone away, and I can tell you almost every single person that I see every day does not have health insurance or is sponsored by Medi-Cal. So, why is our public option not working right now? It's broken, it's overburdened, and there's no support. We need to make a public option that works. And when do we have to do it? Now. Exactly. What we see over at the county every day is that people come in and it's too late. They've been scared to go find a doctor because of the bills that they have to pay. And when they come to see us, it's too late. It's a catastrophe. This is the equivalent of catastrophic insurance. There's no preventative insurance right now, so if we fix it, we can have preventative insurance as well. Sit here and tell you innumerable stories of patients who have come in and have had to suffer serious consequences because they let their disease last too long before they have come for treatment. I'll tell you a quick one. A woman I recently saw just a few weeks ago. She knew she had a skin cancer on her arm. She actually had a biopsy 3 years ago when she did have health insurance. Soon after that, she lost her job and never went back because she was scared that her treatment would cost too much money. 3 years later, she now comes to see me, and that skin cancer has covered almost half of her arm. I don't know right now if she'll be able to keep her arm. We're doing studies to see, but if she has to lose her arm, 3 years ago, it could have been treated in half an hour. For stories like this and the thousands of others that walk into that hospital every day, we need a public option. We need a public option that will provide quality and affordable care to as many Americans as want it, and that includes everyone. And I urge you to talk to your local representatives and to express your support, as we are over at the LA County Hospital, for healthcare reform that includes a public option. Thank you all for coming out here. I'd like to thank you for listening to me, and I'd like everybody to give a big round of applause for healthcare reform.